Physio Talk, the show where we talk about fascinating things that happens in physiotherapy. And in today's video, we are going to discuss about aquatic therapy. And to discuss about aquatic therapy, we have a special guest with us who is expert in aquatic therapy with more than 25 5 years of experience as well as 20 years of experience in aquatic therapy and currently who is working as a aquatic PT facility in charge in Qatar Rehabilitation Center. And Dr. Prashanth, Dr. CG Prashanth, sir, thank you so much, sir, for accepting our request to join us, and it's an honor to have you with us.
Thank you. Thank you so much, Prem. This was just out of the blue. I really appreciate that you picked up this topic at this point of time. It's very appropriate and it's very relevant to the current time.
And sir, I like the backdrop you have. Like I can see that already you have
Yes.
aquatic pool over there,
Yeah.
and I think that's a perfect
Yeah.
for this topic discussion today.
Yes.
Right. So, sir, to start with, can you please tell us all about your journey in aquatic therapy and what changes you have seen since you have started?
Well, my background is from physiotherapy. So I did my undergraduation from Mangalore, MBCT way long back. And my interest was specifically in cardiology and neurology. But I think
Okay.
in the end, neurology won. So I did my master's in neurology and psychosomatic disorders. And in neurology, we have this specific challenge because we see patients who are paralyzed and it takes a lot of time for their recovery. So the neuro rehab part is quite challenging for us, actually speaking. And so I was trying to look for solutions where I can make this a little more easier. All
Right.
right. And as part of our academic postings, I was posted in a school for exceptional children, USHA. This was
Mhm.
in the Harvard. The school was based in Hubli. While I was working as a lecturer in Indian College of Physiotherapy, we had this posting to the specific school. And this school had a pool.
Okay.
And we had one swimming instructor taking these kids to the pool. And I saw that some of these kids who had challenges in mobility, they were very afraid to go to the water and they were crying. So this created a curiosity in me. I said, children should actually be enjoying water. Why are they afraid? Then
Right.
when I went back to my library and I was able to find books associated with hydrotherapy, I'm really lucky and fortunate I was able to find them. I ended up reading most of those books. And then I realized that okay, we could try something with the kids in the pool. Then we discussed with the Usha school, and then I took these children in the pool for a month's time, and there was a drastic change.
Hmm.
Now, the children who were not willing to go to pool, now they were looking forward to come to pool because we
Right.
changed their experience of something of fear to something of pleasure and joy. And that's when I actually realized the power of water and how it can make big difference. These children who had so much of challenge in moving on the land, they found that moving in the water gave them to experience freedom, which they could not experience anywhere else. And their mobility improved, their trunk control improved, their health control improved. And that's when I realized, you know, this is really a wonderful area. And it just complemented my objective of finding something for neurological patients. So I picked this up. And from then, I think I started somewhere in 2005, this journey. I think we complete exactly about 20 years,
Right.
2025. So I went on doing a lot of training in various aquatic concepts and
Okay.
realized that it should not be only practiced, it should also be taught because many therapists are not aware about it. So that's how I ended up practicing as well as teaching aquatic therapy. I think that
Nice.
summed up. Yeah.
Right, sir. So, sir, like since then, and if you say like as you mentioned, 2005 you started, and now it's 2025. So, how will you tell like this field has evolved since then?
Oh, a lot. Imagine, even in India and outside also, it has been evolving a lot. Aquatic therapy is essentially old, but also young. Because Hippocrates actually proposed aquatic therapy for orthopedic conditions way long back. You can
Mm-hmm.
see his recommendations way long back. But the exact structure, the way of giving therapy has been evolving over a period of time. And aquatic therapy met with the challenge of creating evidence or developing evidence because collecting scientific data on the effect on the body within the water was a challenge in itself. But
Right.
now with so many advanced technologies which has come where I have waterproof heart rate monitors, I have waterproof EMG electrodes, and variation in the pool designing structure and ease of access to these pools. Now we have pools. The current pool what I'm working in Qatar has pools which has floors that can move up and down and can adjust the height of the immersion of the patient. And all of this changed our method of application. At the same time, we also had evolution of concepts, where, like water-specific therapy, which got evolved from Halliday. James Macmillan was one of the person who founded this. And over a period of time, there are other concepts which jumped in. So
Mhm.
just like as you have NDT, as you have brainstorm, as you have PNF, we have aquatic concepts which have got a specific set of principles, and now evidence has becoming more stronger on all of these concepts, how to apply them. And
Right.
even the physiological benefits of immersion also has been documented very well now. Awareness is much, much larger than compared to 20 years back. I
Right.
think initially I started with an open public pool where the temperature was very, very cold, and I could give treatment only during my summer period, maybe from February, March until April, May. Once the monsoon begins, then I'm shut. But
Right.
now, as you can see, this is a nice, wonderful pool. This is the heated pool. And now we have infrastructure coming up. So the therapy happens throughout the year. And we have underwater treadmills coming in. We have underwater trampolines. We have underwater many equipments that have joined it. And that is changing the whole game. And that's making aquatic therapy become more and more effective. And even the research is growing now. We have many tools to do research. So there is enough evidence for aquatic therapy now. So that's a big difference.
Perfect. So perfect. So, sir, are there any specific skills or knowledge areas that students should focus on to excel in aquatic therapy?
It's a good question. Interestingly, what happens is uh, aquatic therapy has evolved itself into a subject. It
Mhm.
is evolving itself into a disciplinary service, which means a patient can be referred to physiotherapy, patient can be referred for occupational speech, and now patient can be referred for aquatic therapy. So you
Aquatic.
should start differentiating this as an unique specialty in itself, right?
Right.
So yes, you need a very specific skill set, a specific adaptation capabilities for you when you're doing the aquatic therapy. First of all, you should get acclimatized to staying in this water environment for a longer duration of time. Because on the land, you don't have to change the clothes, you don't have to be wet to give the treatment, you're not exposed to chlorine and things like that. So when you're doing an aquatic therapy session, you should be willing to be present in the water, understand how the properties of the water behave with the human body. First, how it behaves with your own self, and then later on, how it behaves with a normal person, and then how it behaves with people who have mobility challenges, people who have weak muscles, people who have variation in tone, people who have pain, people who are not putting enough weight on the extremity. So when you are able to differentiate this and you develop skill to support this other person inside the water, then you
Right.
have the ideas to build your strategy of trade therapy plan. So understanding the fundamental knowledge of water, its properties and hydrodynamics, how to design exercises using these dynamic properties and principles, and knowing information about the concepts. There are many concepts, and how to translate that into clinical application, starting with simple cases to handling complex cases. So this would be more or less what a physiotherapist needs to know. What he
Right.
doesn't need to pay so much of attention is the anatomy and biochemistry and all those things because they already covered it in their undergraduate. So they
Right.
can now start focusing on how does physiology change when a body is immersed in the water. That physiology is different. So they need to be aware about that particular
Right.
information. Yeah. So that's the
Perfect.
difference.
Thank you so much, sir, for this because this was really insightful. Because nobody thinks in that way. Like, yes, actually, as you said correctly, we have to go inside the water and we have to think like what physiology will be there when we are going inside the water. Yeah, so that is going to really
Exactly.
help all the students for this. So my next question about this aquatic therapy is, why do you think like aquatic therapy is not as widely known or practiced as traditional physiotherapy, or how can the perception can be changed about this?
Uh, Another good question, because when I started my journey with aquatic therapy, I used to go to this public pool. And the public pool, when I'm doing exercise in the pool, people didn't know what I'm doing and why am I doing. I had all these noodles and I had all of these dumbbells and all of these things. And I was using them in the pool. And they were wondering, they didn't even know such kind of activity is possible. I'm talking about 20 years back when I was
Right.
going in the pool. And they became curious and they started asking me questions. Okay, what is this? What is noodle? When I told them this is an aqua noodle, they were like,
Huh.
why you call this a noodle? So I understood that there is lack of awareness amongst the general public about how water can be used for therapy purposes. This is one of
Right.
the things. And in a country like India, water is not thought about as a means of an exercise environment. It is thought as an recreational environment. So
Right.
if I ask amongst the group of students or amongst the public, how many times do you go to a pool in a year? I think most of their answer would be only when they go to Goa or when they go to a holiday or when they go to a resort, they jump in the pool, they have fun, and they come back. It is very rare that the percentage of people who use water for exercise, like doing swimming on a daily basis, doing 10 laps, 20 laps, 30 laps, the percentage of population is less. So
Yes.
this awareness is something which is not there. This was one of the reasons why it get so early recognition. The other thing was the therapists themselves, because the therapists also were not aware about how they could translate the benefits of water to a therapeutic medium. And this was another challenge. Uh, the third challenge was the infrastructure. So
Right.
infrastructure was, we didn't have enough therapy pools. We had big public swimming pools that was open. It was not even indoor. Uh, and it was a challenge to take patients into the pool and taking them out of the pool. Access was a big challenge in the beginning. Even to transfer patients in and out, it was very challenging for us. We had like three people, four people lifting them in and out. But these patients, once they got started getting benefited from this, patient who was unable to stand, he started walking in the water. Then the realization started coming. Okay, this is wonderful. So
Right.
I did a study with IAP distribution of colleges across India. I divided the whole of India into north, east, south, and uh, west, east, west, south, and north categories. Then we sent in a questionnaire and we did an awareness check. We realized
Mhm.
that the challenges faced for aquatic therapy was on three prongs. One was awareness, one was on education, third one was infrastructure.
Right.
So we had to address all these three issues. And I think now, compared to 20 years and now, there is a big change. A lot of people are aware about aquatic therapy. A lot of therapists are educated about aquatic therapy. And a lot of pools, which are therapy and indoor pools, are coming into existence. So definitely, there is a big shift. When I started, I think we had about 5 or 10 aquatic therapy centers in my knowledge. Now I
Mhm.
think we have more than 70 or 80 therapy centers across India. So that's a big change.
Right.
But it's a very
Yes.
growing market. It's a very growing therapeutic medium now. A very big
Right.
advantage for that.
So, sir, just I'm just curious about this. Like, this is out of the list question. I want to know about. Like, as you mentioned, people are regularly not going in the water. So, how important it is to know swimming to become an aquatic physiotherapist? That is my first question. And second question is, as you mentioned, like infrastructure is required. So, how much expensive it can be?
Both are, again, interesting questions. This is something that I get asked almost all the time.
Right.
Swimming is an activity. Okay.
Hmm.
So if you ask me, do you treat patients while swimming?
No.
I cannot, right? Logically, I
Right.
cannot swim and treat patients at the same time. So,
Yes.
to the question that, okay, you don't need to know swimming, but
Hmm.
you need to have water acclimatization. That means If you are having a fear of water yourself,
Mm-hmm.
that will transfer that fear to the patient as well.
Mm-hmm.
In the water, then your fear also gets dimension of treatment skills and treatment, touching the patient and delivering the techniques. So I would say you don't need to know swimming,
Mm-hmm.
but you need to have a good acclimatization with water, which means even if your head goes down to the water, you should know how to recover yourself, that you're
Right.
confident in recovery. All right. So, and the whole therapy pool is at a depth where my feet is always touching the floor.
Right.
When I'm giving one-on-one sessions, it's always touching the floor. You can take water exercises when you become confident. So
Understood.
there is a gradation line in terms of skill set and the
Mm-hmm.
gradation line in terms of delivering treatment. So knowing swimming is not mandatory, but being acclimatized with water would be very, very effective in delivering your treatment. Okay, so this is
Perfect.
your
Perfect.
answer for the first question. The second question is very tricky because you asked me about the cost of these therapy tools.
Yes.
It's a very big question. I will try to answer it in multiple fronts. First is the size of the pool. Your cost is determined by what size of the pool that you're building.
Mm-hmm.
This is the general information for all of you. In my experience, I also do consultation for building therapy pools. I try to bridge
Perfect.
the gap between the end user requirement to the engineers because engineers think somebody asks for a pool and just give a swimming pool. They don't give a therapy pool. Therapy pool has got different requirements. Okay,
Right.
you have to understand that swimming pool could be used as a therapy pool, but it is not necessary that the therapy pool can be used as a swimming pool. Okay,
Perfect.
so this
Yes.
is a small differentiation. Please understand. So, which means a therapy pool can be small. It doesn't have to be as big as therapy pool, as big as a swimming pool. So the cost primarily is boils down to how big size of a pool you want to have. Okay. So I
Okay.
usually put this into three segments: a small size, a mid segment, and a premium. So what you see behind is like a premium segment. I call this a
Mm-hmm.
premium segment because I can do group sessions here. I can do one-on-one sessions. I can do WhatsApp sessions. I can do IT sessions, and also I can take a course. So this I call this as a pool, which is at a premium size, which is ranging between 5 meters by 10 meters. This is a big
Right.
size pool. So now you have to calculate the per square feet cost locally that the local contractor charges you and multiply it by the total square feet of area
Right.
that you're building. And that will give you your only the pool cost, that is the civil cost.
Mm-hmm.
Okay, so this is the basic infrastructure. Then you
Yes.
have to look at it being indoor. That will be an
Mm.
additional cost. As a thumb
Yes.
rule, your shower area, changing area will be an additional expense. As a thumb rule, the deck space and the pool area should be equal to that of the pool space. This is a thumb
Perfect.
rule. So if you have a 500 square feet of pool area, the deck and other area also has to be 500 feet. So what essentially happens is you have to multiply this cost again. That will be your additional
Mm-hmm.
cost. And then comes your electromechanical components, which is your filtration, your heat pump, and different other things. So that would be an additional cost. So these three costs are the things that you have to calculate. You can't have a very specific ballpark figure. So let's take, for example, you have to multiply this. I don't have a calculator at the moment. Let's say, for example, 500 square feet. It's 1,000 rupees per square feet is a construction cost that will cost
Mm-hmm.
about 5 lakh rupees. Add another
Yes.
5 lakh for the other infrastructure, the uh, shower
Requirements. Yeah.
area and requirements. That be about 10 lakhs. You have to put another 5 to 6 lakhs for the electromechanical component. So it would be for a 500 square feet to approximately 15 to 16.
15 to.
But this is just
Okay.
an average with what we're trying to calculate as per the per square feet cost of 1,000 rupees. Now you have to start calculating it as per the local construction cost. I hope that
Understood, sir.
gives you a fair
So,
idea.
yeah, yeah. So I
Yeah.
understood basically that yes, the basic cost will be around this much, and as much facilities you want to include, the cost will be increasing for the same
Yes,
experience.
yes,
Yes,
yes, yes.
perfect, sir. So, sir, as we are discussing about aquatic therapy, can you tell me like what advice? Because this is all for the students, physiotherapy students. What advice would you give to physiotherapy students who wants to specialize in aquatic therapy?
Well, get into water first.
Yes.
So start being more frequently being present in the water. Uh, for physiotherapy students, what happens is they're still learning about physiotherapy itself. All right, they're
Right.
still learning
Right.
about handling patients on the land, handling concepts, learning about concepts on the land. Allow yourself some time to explore this particular area. When you are in internship, that is the right time to start plunging into pool uh, to understand how to apply this clinically. You can have a basic information and knowledge at the second year when you have your exercise therapy.
Yes.
I think Indian curriculum also has hydrotherapy at this space. Get the
Yes.
introduction, get the principal side, do some exercise in the pool, start handling as a part of your rotatory internship, rotatory clinical postings, handling simple cases in the pool. And then do an foundation course when you're about to finish your bachelor's. You can do 1 day introduction program during your undergraduate program. That will give you enough information and knowledge for you to start thinking about it. If you find it interesting, if you find that being in water is your thing, and if you get attracted to it, then you have to pursue. Because you have to be aware, aquatic therapy is not like physiotherapy. The
Okay.
biggest challenge for us is we have to always carry our swimming costume. You have to carry shampoo. You have to carry moisturizing lotion. You have to carry comb. We have to do all of these things. This is an additional package that we do. And we have to be ready to be wet for 3 hours or 4 hours being in the pool, staying with the patient, and then come out and you can't go to party immediately. Somebody
Right.
calls for a party or a get together. I can't jump out of the pool and go. No, I need to take my shower, dry my hair, put my dress again. So all these are additional things your it will come as a package for you. If you think that yes, I can do all this because I love doing this treatment in the water and I love to give some making a difference to this patient, then yes, that will be
Okay.
your thing.
Understood.
So find if aquatic therapy is your passion. Is it something that resonates with your line of treatment and line of work? If it does, then pick it.
Okay, sir. So, sir, like you have worked in India also, and as well as right now you're working in Qatar. So, what difference do you find when you're practicing aquatic therapy in both the places?
Oh, you put me in a fix. A lot of difference. A
Okay.
lot of difference. Well, I have my own pool in India, and I started my practice here, and it's still running. In terms of quality of service that we're able to offer, and the way we do our documentation, and the way we are able to work on quality improvement ideas, is still nascent in India. It's still in the beginning phase because we are still developing infrastructure. We are still looking at tools have to reach the clinical population. It's in a
Right.
very small percentage of growth. The competency of the therapists are still not very high because aquatic education has been predominantly very popular in the past 6 or 7 years, or let's say
Right.
8 to 10 years, it has become popular. And there are more therapists joining in, there are more tools coming up. So it's still in the growing phase. Whereas in Qatar, where I went, the pool was already there and patients were already there. All I had to do was bridge them, bring in the technical approach, bring in the competency, and we will go on the first day. So the number of visits or patients that we see there in Qatar per day is on an average about 60 to 70 patients per day in our
Oh,
facilities.
wow. Okay.
So, and here the challenge is maybe 8 to 10 patients in a day, given the type of facility we are working. But the most important thing is aquatic therapy is still not considered as a full-time job.
Right.
The percentage of people who are doing aquatic therapy as a full-time job is very, very less. But our team, what I have in Qatar Rehabilitation Institute, is a complete aquatic rehab team. So we start our patients in the pool in the morning and we end our day with the patient in the pool. So for 7 to 8 hours, our focus is only on aquatic therapy. So
Oh,
this brings in a big step in terms of competency, in terms of improving patient care, in terms of generating data, which will be very useful for collecting retrospective evidences, and also learn how new technologies can be adapted very fast into the code.
right.
Okay,
Yes,
so
yes, yes.
these are the big things that we are seeing. In India, it is growing, it's catching up. And
Hmm.
I think Aquatic Therapy Network of India, of which I founded this to spread the work in India, it's doing a fantastic job. We held the National Aquatic Therapy Conference last year, and we will be
Hmm.
having something this year as well. So, which is to spread more knowledge and information, spread more idea about research, spread more idea about new technologies that are coming in, so that aquatic therapy in India can catch up with the rest of the world. So there is work happening as well.
Perfect. So, sir, when you say like you are treating 60 to 70 patients in a day, so obviously that they will not be all of neurological conditions or any orthopedic condition. It
Yes.
will be a mixture of
Yes.
conditions, right?
Okay, let me give you some idea about the place where I'm working. It's a rehab institute.
Hmm.
So I have patients from all the time. So my facility caters to subacute patients and chronic patients. So we
Okay.
have predominantly neurological patients with spinal cord injury, traumatic brain injury, and stroke, which forms a major chunk of our inpatients. We also have MSK patients who are in the geriatric category who we have. We also have pediatric patients, inpatients and outpatients. And again, we have both men as well as women. So we have both the categories. So if you
Right.
say I'm seeing neuromusculoskeletal and pediatric patients in overall. And we also have certain patients who come for general maintenance and fitness who are elderly population. They don't have any specific clinical problem per se, but they would like to remain themselves fit. So we have some
Perfect.
program for them as well. So it is a combination of all of these type of patients.
So we
So
can say
pediatric to
prehab
geriatric.
patient, or yeah, prehabilitation also is coming, rehabilitation is also coming.
Yes, yes, yes.
Yes.
So
Perfect.
we see patients on an average about 15 sessions when they get one time referral, and based on the condition and the requirement, we renew the referral or the patient renews the reference, and they take it as long as they're able to achieve a clinical outcome for their functional daily living.
Perfect. So, sir, truly inspired, and I really want to know, like, if some students or physiotherapists who wants to learn, who wants to take workshops or seminars about aquatic therapy, where where can they find this information about from, and where can they get it?
Okay, I'll give you two, three areas that you can look for. I'm totally unbiased on this. The
Yeah.
first thing you all would like to do would be attend a one-day program. Okay,
Okay.
this is to give you an insight into what aquatic therapy actually is. It will give
Hmm.
you hydrodynamic principles, properties. We go into the pool. There is a theory session in the morning. There is a practical session in the afternoon. This is a one-day program offered by Aquatic Therapy Network of India. We have our own team of instructors and tutors who do this. We have a standardized program which will help the therapist to get an idea whether aquatic therapy is for them. Okay, this is the first
Understood.
step. When you find it is very good, nice, then the second step is the program that I'm doing as part of APNI educational activity, which is the foundation course. The foundation
Okay.
course expands into the introductory one-day program. It elaborates a little more clinical application. It looks into evidences. It looks into clinical practices and other things. Okay. And the third is a very open domain. I'll go split one by one and I'll explain to you where I'm coming from.
Hmm.
So when I started going into teaching lines, because I was also academics and I picked up aquatic therapy in teaching, one of the first organizations that I joined was IETF, this
Okay.
International Aquatic Therapy Faculty. It's a center based out of Switzerland. This is where I became a member first. Then I
Hmm.
became an assistant lecturer. So I'm teaching a specific concept, and I'm getting trained to become a lecturer. Okay. So
Okay.
now WST is one of the concepts that you can apply, which is specifically focused on one of the property called as metacentric effect, and we design exercise based around this. So after you do your foundation course, you can pick up concept-based specializations. Okay,
Understood.
so IUTF offers specialization with the WST, which is water specific therapy, and also Badargas ring method. These are the two
Mhm.
prominent concept-based approaches. This is one. Then, if you go to fitness, because we realize that aquatic therapy is a holistic tool.
Right.
It's not only catering on therapy, it's also catering on fitness, it's also catering on well-being. So
Yes.
apart from therapy, you also have aqua fitness instructors who are doing things, So you can also look at how the patients who have recovered from therapy can sustain the recovery by keeping themselves fit. So you have the aqua fitness programs. So this is done by AEA. It is one of the well-known organizations. There are many organizations, but our association is with AEA because it's based out of US. They have a very well-structured program. AEA is Aquatic Exercise Association. And you will find the information on aeaway.org. This is the website, and you should be able to go there and look for certification. So AEA certification will make you a fitness professional. There is online module and a practical module. You can do an online module and wait for HNI to do the practical module. So, for example, last year we did a practical module for the same, and then
Mhm.
you get certified as an aquatic fitness professional. Then you can apply this for patients who needs to be trained to become or retain fitness, but also it can be applied to the general population as well. Then the
Right.
last comes is the well-being and wellness. In this area, there is Aichi, and then there is also Watsu. I think Watsu is something which has become popular because one of our therapists, Pooja, is doing a very fantastic job in Mumbai about spreading this work of giving Watsu sessions. It's quite popular
Okay.
on Instagram as well. So, Watsu has been spread in India by Watsu India. This is an organization. And I've been part of WABA, which is Worldwide Aquatic Bodywork Association. I was the co-chair until last year. Uh, we do a work on aquatic bodywork, which is basically on well-being and wellness, having therapeutic values across the world. So there are many aquatic bodywork programs that you can check in. It is in waba.pro. This is the website where you will find these courses. And also Watsu India is watsu.in. Again, you will have many courses listed out there, which is associated well-being. So you have a choice. As I said, it's a subject in itself. You can choose therapy, you can choose fitness, you can choose well-being, and see
Well-being.
how you can integrate all of these to the patients.
Right.
So we realize that the patient does not need only therapy; he also needs fitness. He also needs feeling good about himself. So now, water offers all of these things. I hope
Perfect.
that gave you a fair idea.
So
With aquatic
that gave a
therapy, we are
perfect
doing the
information. Yes.
yeah. Sorry, with aquatic therapy, we are with HNR, we are doing the one-day program and the foundation course. For the
Mhm.
concept-based, look for IUTA, for WST and BRRM, and also they're doing something about lifestyle diseases this year. And also look for AEA for fitness and
Okay.
WABA.pro or Watsu India for the well-being courses.
Thank you so much, sir, for all this information. It's going to help all the students who are interested in aquatic therapy, especially, and to
Thank
discover
you.
their own specialty. Yes. So now, just out of curiosity, as you are already sitting near the pool, if you are comfortable,
Yeah.
can you just show us around, like what all things are there?
Okay. I think I have to take down the camera and go around. Is that okay?
Yes, sir. Yes, sir. Yes.
Okay. All right, so I have to tell a little bit about this place.
Hmm.
This is Rajendra Hospital
Hmm.
and Research and Rehab Center located in Dharampur.
Okay.
We chose Dharampur. It's in a very rural area, and this was the dream project because uh, this was in a rural setting. It is very difficult to develop aquatic therapy in this part of the country and even this part of the place itself.
Hmm.
So I really appreciate that this hospital took the initiative. As part of the project, I was involved right from the construction to commissioning the project. So
Right.
this pool is a therapy pool. I will just turn off the camera and I can show you around.
Yes.
Okay. This pool is designed for pediatrics as well as for adults. So you can see the steps here.
Hmm.
Depth is a very important component you need to have in the pool. So
Okay.
if I don't have a movable floor, how can I make my pool of different depth? So I've created this here, which is three different levels. I can use pediatric patients for of different heights. So I can use this pool very effectively in this case.
Hmm.
This is the whole pool. Uh, The depth varies from 1.2 to 1.4 meters.
Okay.
And I also have a deep pool on the other side, which is essentially used for, it's a flat depth pool. This is essentially used for doing deep water exercises, which is mostly for
Okay.
fitness. So I have
Okay.
something which is exclusive for fitness and something that's exclusively for
Therapy.
the therapy as well. So, and we have the shower area very close by. So we have the aquatic equipment store, we have the filtration unit, we have the shower area and WC. This is the male, and this is the female side. So these are the lockers. So in a simple setting, we have created enough. We have about two showers and one
Mhm.
WC and one changing room. So this essentially is a space. It's
Right.
designed big enough for a wheelchair to be going in and out. Okay,
Nice.
and this is again having a heater. So this space is again good enough for a person with a
Mm,
wheelchair and an assistant to
right.
help help the person. Yeah. So yeah. So
So
we'll be starting the foundation course tomorrow morning. So we are all getting set.
nice. So thank you so much for giving this tour. And it was really nice of you and kind of you for giving this tour. And we got to learn so many things from
Thank you
this
so much.
session. And I'm really excited for having more sessions about aquatic therapy with you in future. I know that
Yeah.
you have time constraint. I'm not going to take much time of yours. Just the one last point, if you want to suggest again to physiotherapists who wish to attend this programs. Just one last point, like if you want to conclude it.
Well, take aquatic therapy. First is to find if you're interested in aquatic therapy. And when you pursue aquatic therapy, pursue it seriously. Because for me, it has become like a purpose that I want to really spread this information and knowledge. There is so much to do. There's so much to do in aquatic therapy, in the area of aquatic therapy. Take it seriously. The big point of water is you have fun and you have therapy, and patients also enjoy it. And adherence of patients to therapy is also very high because patients love to come and have fun in the pool. So you have a unique advantage of using the water. So think about it and start from the basics. I say once you get your ABCD right, you can make as many words as you want, as many sentences you want. So I would say
Right,
that get your fundamentals right. The concepts are always there. Once you get the fundamentals, you know what to build it upon. Okay, so
right.
that would be my word of advice or a suggestion.
Thank you so much, sir. And
Yeah.
from my side, I just need your permission that this video I'm going to publish it on my channel as well, for the betterment of all the students to get advantage of all this information and get motivated by your insights. So I hope that is okay with you.
Yes. Yeah, yeah, that is okay. Definitely. I think that was the whole idea. Remember,
Yes.
awareness. This is about awareness.
Yes, sir.
Spread
Yes, sir.
awareness
Yes, sir.
about it.
So,
Okay.
sir, thank you so
Right.
much for your
Thank
time,
you.
and yes, means a
Thank you,
lot.
Prem.
Thank you. Yes. See you
Thank you
again,
for
sir.
hosting and having this topic. Actually, it really
Yes,
means a lot.
sir.
Thank you.
Thank you so much, sir. Thank you.
Thank you.